In this lesson, you will learn about the regulation and review process for OTC drugs in Japan. Why does Japan promote self-medication? Japan faces a rapidly aging society, and the birth rate is declining. The burden on the social safety net is thus increasing. To protect universal health coverage with limited financial revenues, self-medication is promoted as one solution. That means self-medication covers the treatment of minor illnesses to prevent the progression of disease. And more financial revenues can be leveraged for the treatment of severe illnesses, such as prescription drug use in clinics and hospitals. The aim is for all patients to have access to the necessary medical care. In Japan, OTC drugs are defined as drugs other than prescription drugs. OTC drugs are intended for use at the discretion of general consumers. Anybody can purchase such drugs at a pharmacy or a drugstore without a prescription. Here are the conditions required of OTC drugs. Quality, efficacy, and safety must be ensured. Necessary information must be provided to customers so they are able to choose the appropriate drugs at their own discretion. The drugs must be designed to meet people's lifestyles and health needs. And they must meet the latest standards in the field of medical and pharmaceutical sciences. Review processes and regulations are important to meet these demands. This table shows the number of OTC drug applications, the number of approved OTC drugs, and the review period in Japan. The number of OTC drug applications, the number of approved OTC drugs, and the median review time are shown from the top to bottom row, respectively. The mean number of annual applications and OTC drugs approved was about 600 to 700 during the last 5 years. And the median review time was about 5 to 6 months for the last 5 years. An effective review process is necessary, as there are many product applications. This slide explains how the application categories are decided. Is there anything new about the applicant's product as regards active ingredients, routes of administration, indications, form, or dosage and administration compared to drugs already approved in Japan? If the answer is yes, the product application categories are 1 through 3, depending on what is new about the product. If no, is there anything new about the applicant's product as regards active ingredients, routes of administration, indications, form, dosage and administration, or some combination compared to any approved OTC drugs? If the answer is yes, the product application categories are 4 through 6, depending on what's new. If no, does the product differ from approved OTC drugs? If the answer is yes, the product's application category is 7. If no, the category is 8. Categories 1 through 6 are for new OTC drugs, and categories 7 and 8 are for other OTC drugs. This table shows the data requirements for OTC drug applications. The data requirements depend on the application category. Data requirements for drugs in categories 1, 4, and 8 are shown here. You can see that newer applications have more requirements. Here you see an outline of the review process and conformity audit for new OTC drugs in Japan. A new OTC drug application is submitted to the Ministry of Health, Labor, and Welfare, or MHLW. In addition to conducting a PMDA review, the PMDA consults external experts on the suitability of the product as an OTC drug. After hearing the experts' opinions, the PMDA judges whether or not the product should be approved. If the product is suitable as an OTC drug, the PMDA reports the review results to the MHLW. The MHLW consults the Pharmaceutical Affairs and Food Sanitation Council for approval. If there are no problems, the product is approved by the MHLW. The review process shown here is for other OTC drugs, such as generics. There is no expert consultation, no conformity audit, and no consultation with the MHLW. The PMDA mainly confirms the equivalency to approved OTC drugs. The review process is generally shorter than for new OTC drugs. In reviewing an OTC drug, the PMDA considers whether the product is appropriate as an OTC drug. To approve the product under this concept, the PMDA generally must confirm the efficacy and safety of the active ingredients, whether the indications are widely experienced symptoms or disorders that are readily recognizable by consumers, and whether the dosage, administration, and formulation are easy to use, safe, and capable of preventing misuse and abuse. In categories 7 and 8, the PMDA mainly confirms a product's equivalency with approved OTC drugs, so most of the usual data can be omitted. The equivalency points are the active ingredients, quantity, indications, dosage and form, and specifications. So as seen in this example, the active ingredients and quantity, indications, and other factors are checked by the PMDA to confirm equivalency with approved OTC drugs. Approval standards have been established for certain OTC drugs that have been in use for a long time and are considered safe and effective. The approval standards cover several kinds of drugs. In principle, the authority to approve drugs under the approval standards has been transferred from the MHLW to prefectural governors. The approval standards help us to effectively review the large number of applications. This slide shows a list of the approval standards in Japan. There are 18 categories as of November 2025.